Good afternoon, everyone, and thank you very much for attending. My name is Jonathan Bruin. I'm the chairman of the Bermuda Hospitals Board, and our goal today is to provide an overview of activity undertaken by the BHB and at the same time to be open to you later to questions. I'd like to introduce two members of the board, Cathy Gibbons and Jean Atherton, and of course Vanetta Simons, our CEO, and David Thompson, our interim Chief Financial Officer. This board is committed to a similar press conference every quarter to ensure a high level of accountability to the community. We will share relevant documents, update you on major projects, and report on where BHB is with regards to those vital issues, quality and financial measures. These conferences are an opportunity to dig deeper on key issues and for you to ask us questions about hospital operations, activities and plans. And there will be plenty of time at the end of our session for you to ask those questions. This board remains very committed to ensuring openness, fairness and accountability. Regular press conferences are just one of the ways we will work to build greater trust with the media and community through honest and open dialogue. Every quarter I will bring board members and the chairs of the board subcommittees to report on their areas. Today our focus is on finance. With me, as I said before, is board member and chair of the Audit and Finance Committee, Jean Atherton, and again, chair of our Community and Stakeholder Committee, Catherine Cole-Gibbons. The board has already gone through a restructure process. We now have a high level of clinical expertise on the board. Mrs. Lucille Parker has nursing and nurse leadership experience. Dr. Andrew West, Dr. Colin Cooper and Dr. Alicia Stovall provide extremely important physician experience alongside ex officio members Dr. Cheryl Peake-Ball, Chief Medical Officer for Bermuda, Dr. Michael Wooderkamp, BHB's Chief of Staff. Mrs. Gibbons has communications and healthcare industry experience. Cretonia Smith is a lawyer, and Thad Hollis has labour relations experience. Mrs. Atherton is a senior accountant. Mrs. Wendy Augustus represents the donor community, and the Ministry of Health is represented by Permanent Secretary for Health and Seniors, Kevin Monkman. I'd like to formally thank this hard-working team who have worked diligently over the last 6 months. I'm going to start with a short update on where we are with our strategic planning process. The financial situation of the hospital, and indeed of Bermuda, requires us to take a focused look at hospital services within the context of the Bermuda and international market, and ask questions about who is best placed to provide which services. We are at an unprecedented moment in healthcare history in Bermuda. Certainly the struggle for money for the hospital is not new. You can look back to the 1970s and see the hospital was challenged for revenues. However, at this point in time, it is not just the hospitals that are hurting. All Bermuda is feeling financial pain. Healthcare costs are unsustainable for the island, and there simply is not the money, whether you look at individuals, businesses, or indeed government, to support the rate of increase we have experienced over the last 10 years. So the first question is, what is BHB going to do to address this? We're looking at what services we currently deliver. A big cause of BHB's escalating costs relate to increasing the range of services over the past few years. We employ about 30 more physicians than we did 9 years ago, including cardiologists, anaesthetists, oncologists, hospitalists, and a neurologist, endocrinologist, infectious disease specialist, and palliative care specialist, and a nephrologist. We also have new services, such as cardiac rehabilitation, and new tests that come with those specialties, such as nuclear stress testing. But in this market, the key issues are not about more and faster access. It is about appropriate and timely access with a keen focus on cost control. The BHB is therefore assessing which services it has to offer, such as emergency, inpatient wards and support services, surgery, complicated diagnostic tests, and of course acute mental health services. No one else offers these services, but they are vital to the running of the island. The next stage is to see whether other services could actually be provided more effectively and efficiently by either government or the private sector. Long-term care is a good example. It might have made headlines recently, but there is opportunity for more partnership working in this arena. Be in no doubt that if the BHB is asked by government to play a role in this service, we will. We are a talented service provider. But it is right that government should look into a community-based solution for our island. Solutions such as these cannot be implemented by the BHB in isolation. They force innovative and collaborative thinking with many different stakeholders. It is therefore not possible at this point to identify which services will move from the BHB and which will stay, but we are reviewing everything that we currently deliver. Much has been written about how the BHB has impacted healthcare costs, but the rest of the healthcare market has inflated at the same rate. Indeed, the BHB doesn't take much more of the pie than it did 5 or more years ago. Dealing with just the hospital's cost alone will therefore not address the spiralling costs we are all experiencing. It will simply divert them to the private sector or overseas. If only the hospital acts, that could leave us at a distinct disadvantage over the long run that could be detrimental to the island, especially when the community deserves and requires a 24/7 operation. It is not our remit to change the system, but we at the BHB accept that we must be a full participant in the process. Our strategic process should be completed early in the fall, and board committees are already focusing on their areas. The senior management team will be putting together a draft strategy in August, supported by appropriate data and business cases for approval at committee, board and ministerial level as necessary. We are working extremely closely with the Bermuda Health Council, who do have the system overview, and have also co-opted members of the community into our committees so that individuals from outside of the BHB can bring their expertise into the heart of the decision-making process. The BHB will reshape its services so that it can operate at an appropriate level of quality and safety. However, our financial forecasts currently indicate a deteriorating position that is compounded by lost revenues and further obligations of the new acute care wing. Fees did not rise this year, and we did not receive the final 1% for the new acute care hospital. Additionally, the BHB is no longer reimbursed by government funding for our continued care unit. Until last year, the majority of our CCU resident fees were paid out of a geriatric subsidy. There is a separate fund from the hospital subsidy, which was held flat this year, and the MWI grant, which was held level following a $1 million cut last year. The CCU service costs over $14 million a year to run. Absorbing this cost over the long run is not sustainable for the BHB. It will impact the acute care services we are mandated to deliver and push us further into debt. We therefore need to look how we reduce the cost in CCU in the coming years whilst an effective solution is worked on. At the moment, we have stopped admitting new residents to CCU, resulting in a decreased occupancy. This will slowly reduce the number of clients, and through the natural turnover, we expect to be able to gradually reduce the workforce in this area. We know government is seeking ways to try and assist the BHB throughout this transition, and we thank them for their continued efforts. We will continue to use Gordon Ward for patients in whom the most acute reasons for their hospital care have been addressed, and we are seeking safe and appropriate post-acute services. The issues relating to CCU bring into focus the challenging and complex issues the board is facing. The balancing of clinical quality against the drive to control costs is never easy, and we will never forget that at the heart of this challenge are patients and also the 1,800 staff who work in our 2 hospitals. The board has today made public summaries of the KPMG reports that look at the Memoranda of Understanding with private insurers and government, as well as the BHB's ability to meet its service payments for the new acute care wing. Finally, we have also made a summary of the Towers-Watson report public today. Although these reports highlight cost and revenue issues at the BHP, I would reiterate that costs have risen in the private, non-profit and overseas healthcare sectors too. Additionally, it would be erroneous to seek individuals to blame as the cause of the BHP's issues. Quite simply, we are operating in one of the worst economic times in living memory. The previous board had already begun to recognise this and worked hard by initiating the KPMG and Towers-Watson report, as well as the governance report. The economy is not expected to turn around soon, so it comes to the current board to ensure that we navigate this turmoil and maintain viable hospital services for the island. It cannot be ignored that previous boards, in conjunction with management teams, have worked incredibly hard over a number of years, and it would be inappropriate and unfair not to focus on the many good and successful things that have happened in the past. It is even hoped that some previous board members may be able to help us in our work going forward relating to financial sustainability. I would like to reach out to the media today and also ask your support and help. We're trying to be more transparent in the way that we communicate with you, and we would ask, please, that you take very, very seriously the responsibility that you all have, whether it be the newspaper or the television or through social networking, to ensure that a young mother with a sick child does not feel scared about bringing that child to our hospital, where that child would receive the highest possible level of care because they have read an inappropriate and incorrect statement either in the press or heard it on the radio or seen it in social networking. So I reach out to you. If you have questions for us at any time, please come to us for the full story. Thank you. At this point, I'd like to invite my colleague, Mrs. Atherton, who chairs the Audit and Finance Committee, to say a few words. Thank you.
Thank you, Mr. Bruin. I'm taking the opportunity because we have concentrated so much on finances that we thought it was appropriate to describe the process of how the board deals with finances and who's involved and what we are currently doing to try and ameliorate the situation. The Audit and Finance Committee is appointed by the board. There are 3 board members, myself, Jonathan Bruin, and Quatonia Smith on the committee. We are joined by the CEO, the interim CFO, the Chief Operating Officer of King Edward, and the Financial Controller, along with an administrator. The board took an unprecedented step of inviting 3 members of the community to the committee to enhance the financial expertise and acumen of the committee. These members are Simon Everett, CEO of IMG International Limited, Peter Everson, who is president of PE Consultant Limited, and Terry Falconberry, Operations Manager, Property Reinsurance at Aspen Bermuda Limited. We hold meetings monthly and at least 10 times a year, and we report directly to the board. The main purpose of this committee is to assist the board in fulfilling its responsibilities for ensuring financial integrity and credibility, and ensuring that an effective internal financial control system is maintained throughout the organization. We ensure that there is financial planning, resource management processes that support the strategic direction and corporate objectives of the board. Our main duties include reviewing the audited financial statements, approving risk assessments, reviewing and advising the board of the BHP's financial strategy, approving capital requests from the Capital Resources Committee, and specifying metrics to be included in the board's financial dashboard. We also review the appropriateness and effectiveness of management's financial planning process and advise the board on all borrowings. We recognize that it is in the national interest to control healthcare costs, and I have a particular interest in that, but as I am chairman of the Health Council. But we also ensure that the efficiency and sound financial planning for the hospitals is a vital piece. But it's not the only piece, and we have to recognize that. Bermuda must address what is happening and make sure that healthcare costs are better controlled. Private and non-profit providers are also needed to be part of the solution. We only directly control here at BHP 50% of the national spend. Because BHP is a quengo with about 1/3 of our revenues from the taxpayer, the community has a right to know a great deal about its activities and finances. But it's important to note that while the board has been open with the issues that impact BHP costs, it is erroneous to believe that the current situation is only down to BHP. Additionally, while the obligations of the new acute care wing will increase pressures that haven't kicked in yet, we're still struggling. We will be challenged even without the new facility due to the economic situation of Bermuda and the inability of the island to support the growing cost of health care. The most recent data from our financial department raises serious concerns about BHP's finances and indicates that we will be in debt before the end of the year unless we take action. But we're not standing still. We are dealing with our long-term prognosis, which indicates that we will be more challenged, but we expect that strategies to reshape services and cut costs will help as we improve the regulation of the system. This is a long-term financial challenge for us and the country to address. The Government Department of Internal Audit has completed its auditing process at BHP on the financials for 2011 and 2012, and we have just this week received the draft report. We're now reviewing it, and we will prepare our responses to the auditors, which will include an action plan to address recommendations. This will help us to further improve controls within BHP and ensure higher standards of governance and regulation. A financial sustainability steering committee has been set up, and the first meeting was attended by Brian Dupereau of the Sage Commission. We will be looking to co-opt more community members to this committee to ensure the appropriate breadth and depth of financial planning expertise is available, and we will provide future updates to be shared with the community as we make progress. And I'd like to, before I turn it over to Vanetta, to say that we obviously have been very fortunate to have our interim CFO bringing the expertise that we need, and as we go forward, as I mentioned earlier, having the other committees the other members that have been co-opted to the committee, that's because we're saying we want to have lots of hands tackling this, and Bermuda needs to be encouraged by the fact that the board is reaching out and working diligently on this. I'd like to now hand it over to Mrs. Vanetta Simons.
Good afternoon. Thank you, Ms. Atherton. I want to pause for just one moment. Right now, there are hundreds of people at King Edward and Mid-Atlantic Wellness Institute receiving care. Patient care is ongoing 24/7. It doesn't stop. For the majority of people walking through our corridors and sitting in our waiting areas, keeping a loved one company or about to slide into the MRI tube, the scanner, the hospital's issues are less important than their own personal situation. This is how it should be. When your health is in need, it is the only thing you need to worry about. However, in order to ensure you have the services you need when you need them, the board, the staff here, the ministry, and other healthcare stakeholders have to address major operational, structural, and strategic issues. In order to ensure the safe transition of services to the new acute care wing, we have a major operational readiness project underway. If you are an inpatient on the day we transfer services, you want to find yourself in a new room knowing where things are and with staff who know where, for example, the crash cart is if there is an emergency. So we are preparing, changing processes, testing multiple times, and educating staff so that you are safe. We are working on communications so that the day emergency moves, everyone is aware when they should divert to the new location. During the next year, we will be undergoing a regular accreditation process with Accreditation Canada. And this will help us test our systems and see if we are meeting the standards necessary. This process requires a huge amount of focus from our staff. And so education and preparation is required along with operational readiness preparations. There is a lot of synergy between the two, as the accreditation process will test international patient safety standards, and we want to transfer to the new facility, but it's still a lot of work. We are undertaking a mock accreditation survey in the coming months to test our readiness and to enable us to focus resources on the results. We have just completed an employee satisfaction survey, and results will be communicated to staff in the next few weeks. We will be able to share the results at the next quarterly press conference. Our ability to keep services running while successfully preparing for the new acute care wing and accreditation rests on the shoulders of the nurses and doctors, technicians, housekeepers, and administrative staff. So listening to them and addressing their concerns, hopes, and expectations help us to motivate and focus the workforce. There are some deliverables that BHB is also working toward that are important to ensure quality. Peer review is high on our agenda, but this requires shield legislation so that physicians can participate without the fear of legal action. The process enables clinical issues to be fully reviewed and learned from. We are and will continue to work with the ministry on required legislation. Care maps will help to provide a consistent standard of care for people based on their conditions. Although led by medical staff, care maps require close collaboration between multiple disciplines. Utilization has been discussed many times in many different forums. The Bermuda Health Council's reports have indicated that there is a very high level of utilization in Bermuda. People in Bermuda simply have more blood tests, more MRIs, and more CTs than any other country. The concern is that this is not resulting in improved outcomes for patients. We don't live longer than people in countries who get tested less. In fact, we are generally an unhealthy population with a very high incidence of chronic disease that decrease the quality of our lives and cut our lives short. There is a cost to overutilization. We pay for tests we don't need. While they may satisfy our desires and most likely allay our fears, they don't help us live longer, healthier lives, and they drive our insurance premiums up. For BHB, there is also cost to our overutilization. We have limited ability to raise revenue, and after certain caps are reached, we no longer are compensated for the work that we do. Our challenge is to set the bar so that every clinically appropriate test is carried out in a timely manner, but that we need to ensure the tests that are not needed are not carried out. This requires us to act as gatekeepers and ensure that there are evidence-based backed guidelines that flag unnecessary tests. This process is ongoing and is informed by our medical specialties. A major project is the introduction of an electronic medical record at the hospitals. This project will bring an unprecedented level of coordination and efficiency to the medical process. It also is proven to improve patient safety as medical staff have immediate access to results, planned tests, medication, and medication histories. This is an expensive project and also one that requires medical staff especially to be fully involved and engaged to ensure the system is structured appropriately and is used. We look forward to updating you on this project. Finally, the new acute care wing itself. Mr. Bruin and Mrs. Atherton have already touched on the financial aspects of this project. I am pleased to note that the project is still going well. Over 1 million man-hours have been worked on the project, and about 1,500 people in total have worked on the site. At peak times, there are about 400 people on site, and 65% of them are Bermudian or spouses of Bermuda. Our planned move to the new acute care wing is June 2014. Thank you.
You talked about overutilisation, and that's obviously one of the main factors that drives up costs.
Yes.
But that's, how can you control that? If people are, in the past, just been coming in and demanding testing you've been giving them. Is it now the intention, you mentioned that you're going to be acting as gatekeepers. Are you now going to be saying, well, no, we're not prepared to give you that testing, we're going to give you
Internally, we will work to make sure that the physicians who are ordering the tests are properly advised to come back here. Are properly advised as to which tests are more appropriate. Obviously, we have more control within our rebate, but in addition to that, we're working with the Bermuda Health Council and the Ministry of Health to look at the national challenge and working to see how we can collaborate to address that challenge on a national basis. Thank you. Yeah.
Question. Last week there was the march, for example, but yet BHP communicated that there were clear communication channels. Going forward, how do you help to placate the feelings of insecurity for the staff in light of the digital report that was the result? What do you envision happening?
Definitely with the challenges that we're facing, there will be an impact to staff and an impact to patients. So we've sat down, we've met with the unions, we have a communication strategy in place that will have us talking more to people, communicating with them so that they're not surprised by any of the situations going forward. Yes.
And for some of the services that may become privatized, will that mean loss of staff, or will there be some sort of talk to get those staff to absorb into perhaps where applicable the private sector?
Thank you very much. That's a great question. I think transfer of skill sets will be a fundamental pillar of this. If we're unable to provide the service going forward and it is felt that it's going to be necessary somewhere else, then I'm sure that we'll see those trained and qualified people shift over to another provider. No, we're not suggesting in any way that this is going to happen immediately. We just need to we need to look at the full picture and to see what this community can financially sustain, whilst our primary mandate is to maintain the highest possible quality of service on a 24/7 basis. Okay. Any further questions at this point? Well, I'd like to wrap up, if I may. I'd like to thank you all for coming to this first quarterly media conference, and we look forward to you attending future meetings. I would just like to reiterate and reinforce the point I made earlier on, that please work with us to promote accurate information about what is happening here. Every time there is a negative statement in the press, which is not based on fact, it not only demoralises the staff here, but more importantly, it also compromises the confidence of our fellow Bermudians. And media has a very key role to ensure that we all feel very comfortable about working with the highly skilled professionals that we have the benefit of working with here in Bermuda. Thank you.